When starting an assessment for visual aids, what steps should be taken?
The assessment protocol begins with focusing on the person's visual experience. Identify their primary visual disorder. Determine if there are other visually limiting conditions to consider, such as macular degeneration combined with cataracts, diabetic retinopathy with glaucoma, or retinitis pigmentosa with cataracts, among others. Understand the specific glare problems they are experiencing. Are they suffering from glare caused by bright sunlight, or from an electronic device screen like a BDU or TV, or from overhead lights in shops, outdoors even on dull cloudy days, or at a particular time of day? It's essential to identify the types of glare issues being faced in order to be able to do a comprehensive assessment. Consider any other contributing factors that might affect their visual experience.
What is the next step after understanding their visual experience?
The next step is to assess visual acuity. It's important to record the person's baseline visual acuity at this point. The specific method used, whether a Logmar or Snellen chart, and the distance of the test isn't crucial as long as the procedure can be replicated and is test-retest reliable. Repeat the visual acuity test with each of the selected filtered colors and record those that give the best result. The process is very subjective, and results will vary from client to client, even for those with the same eye conditions. And it's possible that several filters are helpful, perhaps different ones even for different lighting conditions. So it's important to try filters in different lighting, keep notes on which work best for when, and keep all results for further evaluation.
How does the visual acuity assessment help in the overall process?
The information produced from understanding the person's visual issues and their visual acuity will help the assessor identify a selection of filters most likely to provide the most effective solution to reduce discomfort glare. This tailored approach ensures that the chosen filters address the specific needs and challenges faced by the individual.
How should patients' misconceptions about lens darkness related to glare be addressed?
Many patients or clients mistakenly believe that the darker the lens, the better the glare protection. To address this, it's important to check their baseline contrast sensitivity level using a standard CS chart test. The specific style of the chart is not as crucial as long as the method and results are accurately noted for test-retest purposes. This helps ensure that the chosen lens provides effective glare protection without unnecessarily reducing visual acuity or contrast sensitivity.
How should the selected filters be tested for effectiveness?
Repeat the contrast sensitivity test with each of the selected filter colors and record the ones that give the best result. Again, where possible, test under varying lighting and environmental conditions. It's important to note that the best colors identified in this test may not be the same as the ones identified during the acuity test, so keep both results for further evaluation.
How can glare protection be tested outside of real-world conditions?
Testing for disability glare is indeed more challenging since it's difficult to replicate conditions like bright sunshine or the glare from a low morning sun. To improvise, try using a simple method with a desk-mounted task light placed between the assessor and the patient or client. The patient holds the filter in front of their eyes while slowly directing the task light onto their face. Then ask 2 questions. Is the light causing you discomfort? Can you see my face as clearly as before?
How is the best filter identified using this method?
We repeat this exercise with each of the selected filters until the best one is identified. Once we have the best filters from the acuity test, contrast sensitivity test, and glare reduction test, we ask the patient to choose their preferred 1 or 2, as there may be more than one best option. At that point, if it's possible to do some testing outside under natural light and transitioning between sun and shade, the patient may further refine their choice.
What is the key consideration when using filters and tinted lenses?
The vitally important point when using filters and tinted lenses is to ensure that we do not reduce the amount of light entering the eye to the extent that it significantly diminishes visual acuity. Otherwise, we may solve the glare problem, but risk causing trips and falls because the patient or client cannot see obstacles when wearing their anti-glare protection.
How do you select the optimal frame after choosing the best filter?
Noir offers a wide variety of frames that can accommodate adults as well as children, providing a comfortable fit in either a wraparound style or a fit-over that can be worn over prescription glasses. We also offer several frames that feature inserts that can be fitted with prescription lenses. The frame selection process should start with determining what style of frame will best suit your needs. If you wear corrected glasses, you will need fit-over frames that can be comfortably worn over that prescription pair. Alternatively, you can have your prescription lenses fitted into inserts that come with several of the wraparound frame options, including one with a retro look, as well as several contemporary styles. You can also opt for clip-on filters, those attached to your prescription glasses frames. Noir offers a frame selection guide that will help you find the right size. If you don't wear prescription glasses, there are plenty of options in wraparound styles that include modern designs with larger lens shape and tortoiseshell frames, aviators, and some with sleek full coverage.